Milestone achieved. 250 plus bone marrow transplants at Marengo CIMS Hospital. Marengo CIMS Hospital celebrates crossing 250 successful bone marrow transplants, showcasing its clinical excellence in treating complex blood disorders. With advanced techniques, pediatric expertise, and a multidisciplinary team, the hospital continues to lead in delivering life-saving care to patients across India and beyond. Report बिल्कुल online.
तो ये जो हमारे तीन जिसे कहते हैं ना लीडर्स हैं एज फार एज ट्रीटमेंट इज़ कंसर्न, बट इनके पीछे एक बहुत बड़ा टीम चाहिए होता है, बहुत बड़ा इंफ्रास्ट्रक्चर चाहिए होता है, बहुत बड़ा कमिटमेंट चाहिए होता है मैनेजमेंट के टू मेक दिस ऑल पॉसिबल. So each one is a big wheel and each one has a spoke. हर एक का एक रिस्पॉन्सिबिलिटी रहता है कि वो व्हील चलता रहे सक्सेसफुली, that the whole transplant program goes on successfully. So my responsibility is to enable that particular process, that the wheel goes on. So starting from infrastructure, the manpower, the lab services, the follow-up, the funding, the stay, almost everything has to go on so smoothly that किसी भी पेशेंट में कोई ऐसा वो ना आए कि इस कारण मेरे से नहीं हो पा रहा है, इस कारण से हमें तकलीफ हो रही है और सेटिस्फैक्शन कम हो रहा है, या ट्रीटमेंट में कुछ भी एक दर्जा कम किसी को ना मिले. तो मिसाल के तौर पे जैसे डॉक्टर कोमिल ने बताया, वी ऑलरेडी हैव a dedicated transplant unit of 10 beds, completely cabins are separate, everything is all self-contained. उसका जो HEPA filter है, जो मतलब the air which is filtered in has to be a very very high grade filtration rate so that no germs or bacteria or कीटाणु अंदर ना घुसे. It has to be a positively ventilated room कि दरवाज़ा खुले तो अंदर हवा ना जाए, अंदर से बाहर भले ही चले जाए, बल्कि अंदर से बाहर से दूषित हवा अंदर ना हो. अंदर का जो इंफ्रास्ट्रक्चर, जो मेडिकल इंफ्रास्ट्रक्चर जो चाहिए होगा, मॉनिटर से लेके पंप से लेके ऑलमोस्ट एवरीथिंग दैट वी हैव टू टेक केयर ऑफ. अपार्ट फ्रॉम दिस द होल एनवायरनमेंट इज केप्ट सो क्लीन एंड हाइजीनिक कि जो भी काम कर रहे हैं एवरीवन इज ट्रेन टू दैट हाई लेवल ऑफ इन्फेक्शियस डिजीज़ कैसे रोका जाए. जो उसमें जो हमने देखा कोविड के टाइम में पीपी पहन के, ये तो उससे भी 100 गुना ज़्यादा हमें देखना पड़ता है कि जो भी अंदर जा रहा है इज कम्प्लीटली स्क्रीन फ्रॉम एवरीथिंग.
Now it's an open forum if you want to ask any question to our experts.
Transplant. So as we discussed earlier, people who has undergone transplant probably say 10-15 years ago, and at that time supportive system was not great. We require a big support system like HEPA filter room, clean room, prevention from infections, antibiotic, antifungal drugs, antiviral drugs to fight all kinds of infection. Also the drugs which are related to the transplants and newer techniques of transplant definitely. So over last 10 to 15 years the field of transplant has evolved tremendously, and all these facilities, all these drugs are available, all these new techniques are available, and there is so much of diversification. So initially it used to be available at one country, then it was available in many countries. Now even within the country, even if we talk about the India, it is also available. Everything is available in our city in Ahmedabad. So the biggest stigma initially was about the outcome. Now it is no longer. We are nowadays able to explain patients about their outcome, about their disease outcome with the transplant. It is going to be better. Second is about the afterlife. Whether they will be able to conceive the child, what will be their usual day-to-day life after the transplant. And with the supportive care, again, it has also improved a lot over last 10 to 15 years. So yes, stigma is there. Financial issue is another problem. But with the time, with the supportive care, with the help of hospital, with the help of many foundation, government schemes, we are able to help more and more patients to get rid of their blood cancer with the help of transplant.
And do you have any bank of
स्टिग्मा तो बहुत सारे हैं,
जी।
बहुत सारी लिस्ट है। सबसे पहला कि एक स्टिग्मा तो है कि इसकी ज़रूरत ही है क्या, यहीं से शुरू होता है। क्योंकि ब्लड कैंसर्स कई बार लोग कहते हैं कि केवल हम दवाओं से करा लें तो चल जाएगा कि नहीं, किस में होता है। ये स्टिग्मा जनरल पॉपुलेशन का नहीं है। आई वुड गो अहेड एंड से कि ये स्टिग्मा हमारी डॉक्टर फ्रेटर्निटी में भी काफ़ी है, क्योंकि काफ़ी जो जनरल प्रैक्टिशनर्स डॉक्टर हैं जो कि एक्चुअली हमको पेशेंट टाइमली रिफ़र करें, उनको भी हम कंटिन्यूसली एजुकेट करते हैं हमारे प्लेटफॉर्म्स के थ्रू कि किस पेशेंट्स को टाइमली इस चीज़ की एडवाइस की जाए, क्योंकि ये बहुत ही स्पेशलाइज्ड प्रोसीजर है। ये लास्ट 10, 15, 20 साल में बहुत इसने स्पीड पकड़ी है और बहुत सक्सेसफुल हुआ है। तो उस वजह से ये कई जो डॉक्टर्स हैं जो पेरीफेरी में प्रैक्टिस है और अपनी एक सेट प्रैक्टिस है, वो शायद अपडेट नहीं है इस बात से कि ये चीज़ इतना सक्सेसफुल अवेलेबल है हमारे लिए। दूसरा बच्चों में कि बच्चों में हम कीमो देंगे या ये सब मेडिसिन देंगे तो जैसे डॉक्टर कौमिल ने कहा कि ट्रांसप्लांट के बाद इतना खर्चा भी कर लेंगे, एक तो कॉस्ट का बहुत बड़ा उनको एक स्टिग्मा है। उसके बाद अगर हम ये करने के बाद सक्सेसफुल भी हो जाते हैं तो उसके बाद भी है ना 2-5 साल में कुछ ना कुछ प्रॉब्लम आएगी। इतनी कीमो की दवाइयाँ दी है तो उसका किसी ऑर्गन पे इफ़ेक्ट आएगा, इनकी लाइफ एकदम नॉर्मल जैसी होनी चाहिए वैसी नहीं होगी। तो इसमें ये पिछले 10-15 सालों में इतना ज़्यादा चेंजेस हैं, किस में कर सकते हैं, कौन डोनर है। आधा टाइम, ये बहुत अच्छा क्वेश्चन था, आधा टाइम हमारा डोनर्स को कई बार कन्विंस करने में जाता है कि मैं तो 50 की हूँ, डायबिटिक हूँ, मैं कैसे करूँगी, क्या मैं कभी हॉस्पिटल में आई नहीं, गांव में ही रहते हैं। तो ये कई छोटे छोटे स्टिग्मास हैं। अब ब्लड डोनेशन जैसा ही सिंपल हो गया है स्टेम सेल।
So BMT is a process. It is not a disease or it is a treatment process. So recurrence is of the disease. So जब BMT किसी कैंसर के लिए किया जाता है तो डिजीज़ के वापस आने के चांस होते हैं, और ये चांस डिपेंड करता है कि बीमारी कौन सी है। जैसे मैं बात करूँ, मल्टीपल माइलोमा एक बीमारी है। There was a question on stigma, so it's more of denial in multiple myeloma. मल्टीपल माइलोमा जब डायग्नोज होता है तो पेशेंट की शुरुआत में हालत बहुत अच्छी नहीं होती। 3-4 महीने के कीमोथेरेपी के बाद पेशेंट बहुत नॉर्मल सा हो जाता है। वो वक्त होता है जब पेशेंट को ट्रांसप्लांट की ज़रूरत पड़ती है। कई बार उस पॉइंट पे पेशेंट बोलता है मैं तो ठीक हो गया, मुझे तो ट्रांसप्लांट कराने की ज़रूरत नहीं है, आई विल लिव नॉर्मली। प्रॉब्लम इज विदाउट ट्रांसप्लांट वो पेशेंट रिलैप्स करेगा, और वो रिलैप्स मोस्टली विद इन 1 ईयर, 1 साल के अंदर करता है।
Hello, I'm Dr. Hemant Menghani. I'm a pediatric hematologist, oncologist, and a bone marrow transplant physician. That means I treat blood cancers, blood disorders, and I do bone marrow transplants for children. So children, young adolescents, anyone who is 20-25 years and below in age, we do bone marrow transplants for them. So in children there are many diseases, starting from simpler diseases where the blood is not formed rightly, like thalassemia. Here a child needs to undergo blood transfusions every month for the rest of his life. There are sickle cell anemia, blood disorders where all of your organs get a lot of pain episodes. You have aplastic anemia where your the bone marrow stops functioning, so your counts are all very low. Then you have the serious diseases like blood cancers, leukemia. There are different types in children: acute myeloid leukemia, acute lymphoid leukemia, and these diseases, unfortunately, due to our lifestyle and in general our habits, are increasing in incidence and in prevalence. And we see now much more of these diseases than we used to see 5-10 years back. Fortunately, 10, 15, 20 years back, we had limited scope of treatment available for them. For many of these diseases, we only had blood transfusion. You go get blood transfusions, keep doing that for your life. For blood cancers, we have some chemotherapies which we could use. Some of these patients did okay, but majority of them relapsed. In these last 10, 20 years, we have come a long way. We have a lot of chemotherapies that have come. We are much more safer. Now in the last 10 years, there are targeted therapies which target specific site on the cancer. Immunotherapy, because many of these cancers we learned there is immunity that plays a role. So if you check the immunity, the cancers will stop.
Good morning. This is Dr. Ankit Jitani. I am a hematologist and bone marrow transplant physician at Marengo CIMS Hospital, Ahmedabad. Blood cancer is a very a term that really scares the shit out of us actually. So, but this is one disease which has almost achieved a cure that is lasting and that is achievable with multiple modalities. So right now for blood cancer we have various forms of therapy which includes chemotherapy, targeted therapy, immunotherapy, etc. So many types of blood cancer are actually consolidated with a procedure called bone marrow transplant. Bone marrow transplant is not a surgery. It's very different from the other form of transplant like the kidney, renal, heart, lung transplant. It is not a surgery. And the beauty is the donor. The donor does not lose any organ. So the donor donates the stem cell which again regenerates in the donor's
Unlike
body.
kidney or anything.
So, unlike kidney and liver, the donor do not lose anything. Bone marrow transplant are of different types. So broadly if we divide, it's called autologous transplant in which the patient himself or herself is the donor, and the other transplant is allogenic transplant in which donor is somebody else. The person can be the patient's family member, parents, children, siblings, or somebody whom the patient do not know. So the last form which I talked about is called unrelated donor. So there are certain registry in the country who have a HLA bank with them. We can approach them and ask for a match, and those match are from the unrelated donors. So these are the different types of transplant. They are done for various diseases like blood cancers, which includes leukemia, lymphomas and myelomas, genetic diseases like thalassemia, sickle cell anemia, other forms of blood diseases like aplastic anemia, myelodysplastic syndrome. All these are technical terms, but basically these
Today
all.
we are celebrating what? What
So,
event?
so we have gathered today to not celebrate but observe an important milestone of performing 250 transplant in this hospital. So earlier in this hospital, transplant was performed for only one disease which is called thalassemia. Almost 200 transplants were performed successfully. Thereafter, a new team of doctors joined in, and we have started transplanting for almost now close to 2 years. In these 2 years, we have performed 50 more transplants, which include almost all the diseases that I earlier talked about. So now this hospital is performing transplant for all the diseases for which it is actually done, and with a result which we are actually very proud of.
Kindly like, subscribe and hit the bell for more such videos.